Hello, I'm Dr. Brad Holmberg, co-founder of InvisalignDoctors.com. This tutorial is an abbreviated version of Invisalign and the Virtual Mount. The full version of this tutorial can be viewed on our learning website, InvisalignDoctors.com. It's a good practice to ask yourself this question when the first ClinCheck comes back from the technician. That would be either an initial ClinCheck or one for refinement. Is the virtual mount accurate? So what is the virtual mount? Well, it's the articulation of the dental arches performed by the technician. It's reflected in stage 0 of any ClinCheck you view. This is the stage before any movements have occurred. And here's an open bite case. Did the technician mount this case accurately? This is a very good question to ask. If the case is not mounted accurately, the treatment outcome may be significantly compromised. What can we do to obtain an accurate virtual mount consistently? Well, in the next few slides, I will discuss what we can do and also how to verify the virtual mount. It's a good practice to mark occlusal contacts for both arches before the photos are taken. Then use these photos when you submit the prescription. The technician can compare the occlusal contacts on the photo with the contacts in ClinCheck after he mounts the case. You can also send in a PVS bite registration with the records. This is especially important if there are open posterior contacts or a lot of missing posterior teeth. If you do this though, instruct the technician in writing to use this record for mounting the case. If you have an iTero element scanner, make sure the patient is fully closed in CR or CO when taking your bite scans. Digital scanning is the easiest and most reliable method to obtain an accurate virtual mount, and this is especially true in posterior open bite situations. So, how do you verify the virtual mount? You can do this by comparing your photos to the ClinCheck. In the above example, I have used one of the photos submitted with the case and compared it to the 3D model. When you do this, try and orientate the model in the same position the photo was taken. Take a look at how tooth number 6 contacts tooth 27 in the photo and also in the 3D model. This comparison verifies that the virtual mount is accurate in this case. It is possible to occasionally see missing teeth in the ClinCheck 3D model that are actually present in the mouth. The most common reason for this would be the impression or scan did not include that tooth. No matter what the cause, it's very important to verify that all erupted teeth are included in the ClinCheck 3D model. All erupted teeth need to be covered with plastic, otherwise supereruption of the missing tooth or teeth may occur, which could cause premature occlusal contacts and create an entire open bite situation. These situations can be very difficult to resolve. Here's a case that came back with tooth 15 missing from the ClinCheck model. This was discovered by verifying the virtual mount by comparing the photographs to the 3D model. In this case, the record was incomplete, so the technician omitted tooth 15 from the ClinCheck. A new record was submitted and everything came back okay. If you do not cover tooth 15 with plastic, it could supererupt and create a premature contact, and this could result in an entire arch open bite situation. Thank you for viewing this tutorial. Consider joining our community of Invisalign doctors on InvisalignDoctors.com. This tutorial and many more can be viewed in their entirety. Personalized case assistance is also available on our site.